Good morning and a very warm welcome to all our viewers of OrthoTV. It is my pleasure to be your moderator for this session today on the topic titled What, How, and When. Know it all about physiotherapy studying and working in USA. I am sure it is one of the trending topics with a lot of uncertainty about what, how, and when to initiate and proceed with the process of studying, working, and settling in the field of physical therapy in USA. So let's get our minds and path cleared by hearing from some very eminent people with expertise in this particular sphere. So here I begin today by introducing to you our panelist, Dr. Abhinas Sudan. Dr. Abhinas is a certified mechanical diagnosis and therapy clinician with extensive experience in orthopedic and neurological rehabilitation in both India and the US. She is a US board certified physical therapist and has worked in the same country for 8 years, contributing to both clinical and academic areas. She has also been a clinical instructor for physiotherapy students from various universities in the US. It is an honor to have you with us today. Welcome, ma'am.
Thank you.
I now introduce our speaker for today, Dr. Shweta Kulhatkar. Dr. Shweta graduated from Sancheti Institute College of Physiotherapy and has attained her master's from MGH Boston with neuroscience major. She has 10 years of clinical experience working in the US. She is a registered yoga instructor from Yoga Alliance US and a certified nutrition coach from Stanford University. Currently, she practices in India. She practices a blend between physiotherapy and vinyasa yoga named Physio Yoga. And she has established her own company, My Physio Yoga, which is one of its kind in India. Welcome, ma'am.
Thank you.
Over to you.
Okay. Let me just start with the screen share. Thank you everyone for being here, and thank you for giving me this opportunity to all my teachers in Sancheti. I'm going to just start with the screen share first. All right, so this topic is very close to my heart, and I'm going to tell you more about it as we go. Okay, so studying and working in the USA, the what, how, and when. So that's a rough outline about my presentation today, about what we're going to talk. So a little bit about myself. I am Shweta, and I have been a Sancheti. I've graduated from Sancheti College of Physiotherapy in 2008, and since then I have, after a year of experience in Mumbai, I moved to US. So I have around 10 years of experience working in different settings: musculoskeletal, neurological, geriatrics, and women's health. So I also have been a certified childbirth educator, and recently after my delivery, I graduated as a yoga instructor via Yoga Alliance US. So I did my master's in MGH Institute, Boston, with a neuroscience major. And my project was focused on neuromuscular rehabilitation in a glioblastoma patients. So I love to speak, right? So I'm a speaker. I have been a speaker at various schools promoting our physical therapy profession and also community awareness of health and wellness in Seattle. So post my master's in MGH, I moved to Seattle. And basically, I have been working in Seattle most of the time. So I've been also a blogger about motherhood and physio yoga. I focus on blending the two with most of my patients, preventive as well as therapeutic for the rehabilitation. So when I was in Seattle, I also got Graston certification, which is an instrument-assisted soft tissue mobilization, vestibular rehabilitation specialist, as well as I've been a member of American Physical Therapy Association. Currently, I have been doing tele fitness, considering that I've been staying at home pretty much doing with the pandemic. So I'm making the best use of my time, especially with the toddler in the house. So I've been doing tele fitness classes for moms as well as for seniors. And I also practice the Vini yoga, which is basically similar to Vinyasa yoga. So I'm a practicing and a promoting yoga instructor. You can surely check more information about me or any other classes on my website, myphysioyoga.india. Thank you. So let's go up to the topic. So we're going to talk about the whys, the whats, and the hows. So let's go to the why first. Why study in the US? First of all, the physical therapists, right? That's what they're called as, physical therapists and not physiotherapists. They are in demand in the US more than ever. Okay. So per recent study, by 2026, the demand is going to increase, by 30% or so. As per the American Physical Therapy Association, around 12% of US physios are internationally educated. And of that number, 31.4% physios are actually from India, right? So we all have that prospective chance to go to US. So per American Physical Therapy Association, the norms for international PTs are changing. So they basically want all the BPTs, all the MPTs to be qualified in the US as doctor of physical therapy, right? So we'll go talk about this in some of the later slides about what is MPT. To start with, what is MPT? Different, MPT is Masters of Physical Therapy. It is different for different schools, right? The tenure can be different. Currently, very few universities, or maybe none, are actually offering a Masters of Physical Therapy. And the reason is the DPT, right? So Masters of PT is around 2 years, 6 months internship. And the average cost of that can be around $35,000, totaling, up to like 25 lakhs or something. So I know this is what I did. So it was close to around 35 lakhs, so total including of like a loan, right? So talking about the doctor of physical therapy, so that's the standard across all the universities in US. It's 3-year course with 1 year of internship, and it is basically also averaging around 40 to 45,000 K US dollar, right? For basically even more than what it is for MPT. So for people like us, right, who have done Masters of Physical Therapy or Bachelors of Physical Therapy, and even trying, even done Masters in India. So if you want to go to the US, they came up with this transitional DPT program, and more schools actually are offering this program. Most of it is online. Sometimes there is a little bit of lab that you may have to go for that. This costs less, and a lot of my friends who have done MPT, they are now DPT because of the transitional DPT. Okay. So what is the average salary of a physical therapist in India? In US, I mean, sorry. So it is close to 65, starts from 65,000 to 80 to 90,000 dollars, depending on your experience, your knowledge, your background, basically. So why did I choose, or why for me, right? So the reasons that I decided to pursue the further education in the US is, of course, the knowledge, right? You're going to get a different kind of knowledge there, right? So the pursuit of the knowledge about physical therapy, different kinds of, even the culture, the country, the setting, right? So, and we'll go on to that topic in just a few minutes. Of course, there's going to be some international experience that you get, globally certification, right? So you get that international experience, and the family influence, which is big, right? So my brother, you was there studying before me in Rochester Institute of Engineering, basically technology, and that was in New York. So my parents wanted me to go over there, right? So we're going to go, let's go on to the next slide. Let's talk about the house. How I have divided this in 3 different phases. So we're going to talk about the phase 1 first, right after the internship, which most of you may be in that phase right now, right? So the first phase is deciding. The second phase is dedicating and preparation. And the third phase is acting on those tasks, right? On what you have dedicated your time. So let's go on to the phase 1. So I'm going to tell you a little bit about my background. Background meaning how did I get to start with US applications and, after my internship. So I was exactly an intern like you, right? Few years back. This picture is actually taken in our Sancheti classroom, where we were just, of course, having some fun time. But this is where we had to choose where we want to go, what we want to do. So the first thing when I went back after my internship to Mumbai, that's my hometown, the first thing that I wanted to do is get pampered by my mom. Second is do some party and then travel around, right? So I was actually not even aware what I was going to do, right? After that, after when I had my share of traveling and enjoying and getting pampered, so I came on the ground and started knocking on door to door with my novice resume, right? And that's how I was trying to be or connect in the Mumbai world of professionals. There were lots of medical professionals, a lot of competitive market. So I started where I started. I was like, let's do it. But it was not easy, right? It's never easy. It's always a little struggle in the initial stages, and that's what happened. So the first place that I started working in Mumbai was a gynec hospital. I worked as a women's health therapist, and I also developed a motherhood plan called as Key to Motherhood. So this was something very close to my heart. I started with that, and gradually I wanted mentors. I wanted to find even my way out, or not way out, but trying to improve my knowledge, connections. So my gynecologist doctors, they were husband and wife, they became my mentors, and I totally respect them for teaching me to be a good clinician, to exploring other aspects in life, other basically for future endeavors, and most importantly connecting, how you have to talk, right? Communicating with other medical professionals. So something that I learned from them, that is very important. So finally I came to the decision to start the process of US applications, when my mom actually convinced me to convinced with her words, her reasonings, and I did. I got convinced and basically started preparing for that. My brother, like I said, he was in the US, so my parents wanted me to go to that, right? So I actually was not interested to start with to go to US, and the reason for that is I wanted to be here to give my country back, right? So I wanted to use my skills in Mumbai and just start over there. But I got influenced by my parents' decision, right? So that can happen. Like, so you would have to decide what you want to do, where you want to go, and which country you want to do, right? Go, right? So something that helped me is talking to my seniors, mentors, and researching from the valid resources, right? Which is very important. Okay. So let's go to the next. This is where the action happens, right? This is where you actually prepare. The photos that you can see, that's my university, MGH. It's called as Massachusetts General Hospital Institute of Health Profession. And the other one, it was actually affiliated to Howard School, which was of course close to us. That was in Boston as well. So talking about the phases again, phase 2 and phase 3, when we dedicate our time, our energy, and most importantly, our money, we have to start acting as well, and you will even see the results, right? So the time dedication, right? If I have to tell you about myself, I started preparing for GRE, TOEFL, all those exams that every university has. There are some prerequisites that each and every university will want you, especially during this pandemic. I'm sure there are many more different prerequisites. Okay, so I started preparing for that. The funny part is I even went to a coaching classes for GRE, right? So that was something that you have to do, yeah, right? So it's like finally, I got my scores and started applying to all the schools that I think were focused on masters of physical therapy. And of course, there are guides who can help you to make the packets application, and I did use some of them, right? And that was very helpful, I can tell you that, right? So TOEFL, my university actually accepted the TOEFL results over the GRE results, which was not the best for me. And that's how I started. I dedicated my time and energy. Once I got acceptance, right, from one of the universities, me and my parents started running behind banks for loans, right? So something that you have to remember, that if you are going to invest the money, you want more investment back once you start working, right? Once you get that, you should be getting that back, right? So money aspect was a one big one, right? That was something that you have to prepare for, like even just the loan, and act accordingly, act fast, and most importantly in the right direction. Okay, so with the right resources, something that I would say is a good takeaway. We have to remember these three phases and then act accordingly. All right, so after the whole process of acceptance, loan process, you are all done and ready to go to US. It's pretty exciting phase, I can tell you that, and something that you can enjoy the journey, whole journey. It's very important. Okay, so I got my I-20 from MGH. I got it from some other universities as well, but I chose MGH. Then of course the process of visa, right? Some people think it as a struggle, but it is not. It's, you just have to be in the presence of mind and talk, right? So visa interview, application of visa, stamping, and plane tickets, and then fly, right? So it's pretty emotional to actually leave your country and then go to a completely stranger country. Okay, but you have to be doing all those necessary steps, because US is very, very, very particular about all these four steps that I have mentioned. Okay, so even at the port of entry, once you're ready to pack your bags, you will do some meeting. I remember me and my MGH friends, co-students, we met in Mumbai just to talk and discuss who is going to stay with each other. Those were some fun part, or I still have those memories. You do have to do that just to know each other and starting to trust that other person that you are going to be sharing the room with, right? And believe me, I've stayed in a hostel in Pune as well, but it is nowhere similar to staying in a US setting or US apartment, especially considering that you're going to spend in dollars and you are going to be independent. And most importantly, you have to study, right? There's no mom or dad who is going to help you. Of course, you may have family who is going to help you if you have any family over there, or seniors. Very helpful for sure. So once you are, let's talk about the port of entry. I'm just going to brush through this particular topic because it's, especially with the pandemic, I'm sure you're going to require certain specific certifications about vaccination. You may need a lot of different documentation, right? They are, everything in US is about documentation, right? So you have to have all that. Anyway, so once you are at the port of entry, once you put your foot in the soil of US, you feel good. You feel like you have achieved something, and that feeling is really good, I can tell you that. So once you land in the US, they will ask you all the questions. Visa officers, it's almost like the talking. Like I said, you have to talk and give correct answers, right? They may ask you why you're here, which universities, how many years. So it's a process. You can always talk to anyone. I mean, that's why I'm sharing all these things, so that you can know what you are, or you can expect what's coming, right? Especially if you're going to the US. All right. So once you land in the US, there are certain basic things that you have to remember. This is where this is the what portion of studying in the US, right? So now the life in the US begins. So talking about certain basic needs for an international student, you're going as an international student. I think there's, most importantly, like I said, you have to have connections, the people. I'm going to go on the third point here. Good people, good friends, family if you have. call them right away, classmates, and start, it's a trustworthy situation. I do have heard, different scenarios where, the friends went together, but now in the US they were not together in the same room, right? So you have to start trusting people and make good people, meet good people, make good friends, right? Because they are going to help you. Talking about people, there's going to be an international student advisor, which will surely help you to, for any whereabouts in the US. So we had our senior, he really helped us. And, he basically even helped us find an apartment, find a bank account, or, get a bank account, basically, basic things like even just getting books. So they're very helpful. They can surely help you, especially the Indian society in that school. There is going to be that. So the other basic needs in US is the dollars, right? So most importantly, always important is always good to have those dollars, but stop converting, right? It's not easy to bring your brain or just switch your brain off from rupees to dollars or dollars to rupees, right? So it's something that we get over after like a month. Okay, so it may feel like, oh my god, this 10 rupees pencil is almost close to $3, right? It can be like that. So it's a funny aspect, but I think you will surely notice that. All right, so the next one is a good place to live and something more safer. Again, the international students or the international advisor will surely help you with that, and just research on it. Right now, especially nowadays, you will be able to just call someone and or even find some really good safe places, right? Talking about the next, you need a phone, you need a laptop. Something that I missed doing is you can always have a roaming on that phone, right? Just for a few days, an international card, and maybe if you have your laptop, that's great, right? So that those are certain, basic points. We don't think about it, and we just go with the flow. So maybe just take your phone in the roaming and then get a phone over there, right? All right, the next one is communication skills. I cannot emphasize, enough on the communication skills aspect. Something that, as an Indian international student, we want to be only around Indian, population, Indian students, and something that with the communication, if you are, very extrovert, if I can say it like that, talk and connect with other people in the university. You may surely have good network, and you will find good resources, whether it is for books, whether it's for something that you want, right? So communication skills is very important, right? So start practicing that, even just not just English, but just a way to communicate, right? Most importantly, apart from the money aspect, is the food. Learn to cook, right? So I'm going to basically bring a next picture. In the next picture you will see it. Learn to cook, or at least convince your roommate that they are going to cook, or maybe pay them. People do that. Pay the roommate to cook, or get somebody to cook, right? So it is not easy to just not depend. I know at one point you will miss the food from your parents at home, but you have to cook every day to save up the money, to be quick and go to school, right? But I want you guys to relax. It's not always a struggle. Everyone will always figure it out, right? uh, Even before you land, you may figure out everything, all these important points. Okay, all right, the next one here is my memories. So what I've written here is accept and explore the changes. And these changes are going to come your way pretty fast, actually. Just, once you land over there, there are so many changes. Weather changes, accent changes, friends, everybody is new to you, right? So you're already accepting it, but start exploring it. It's very important. Okay, so the first picture is about my first snow experience, and it was amazing, right? And of course, the culture shock, something that everybody talks about. What culture shock do you get? You're going to see different festivals like Halloween. That's one of the pictures. That's, even now we celebrate it here in India. But it is 100 or maybe 99% higher in the US, how they celebrate Halloween and pretty much all the other cultural differences. Okay, clothes, there is, the way people talk, right? Or the way people smile at you, right? Something that every stranger will smile at you. That is just a culture there. Okay. All right, the next one is my photo here is with my roommate. I actually shared a roommate with an American girl. So, like I said, be open about it and communicate, and just have certain expectations, set those expectations, right? So she was very sweet, and this is a Thanksgiving photo, right? That's also their culture. Thanksgiving, Christmas, it's beautiful. So like you said, like, accept it, explore it, and you will have fun. So the third picture is, again, every school which has international programs, they have an Indian community there, right? So every festival we celebrated, we ate, pretty much Indian food. We actually all chipped in, right, in that Indian food. So it's not that we are going to a completely stranger place. I will say this, that there were more Indian population than actually you can see the American population, right? So it's something that after a few years, when I stayed in Seattle, after a few years, I didn't miss too much of that Indian culture, because we used to do everything over there, right? So Diwali, right? Holi, even the teachers actually played with us. So it was actually pretty fun. And of course, this is my whole group of my batchmate. That's the picture that I have over there. And this is a picture of gulab jamun. The first time I made gulab jamun, this didn't turn out really well, right? So you can see that this is really, you explore the other sides of yourself, like making food and even spoiling it, right? So that's what happened. It was not edible after that. All right. So something on that positive note. Okay, talking about the critical requirements when studying in the US. So like you can see, on one side there is what, and the other side is why. Something I actually would like you to focus on is focus on the studies and not the on-campus job, right? Or other entertaining stuff. There is going to be a lot of other distractions. So credits and the GPA system. If you don't get your GPA above like 2.5 or even 3, life can be difficult there, right? So in the first semester for me, I was very focused and dedicated. So I did get a good GPA, but after that I got overconfident, and I actually started, in going down on the GPA scale. So again, I had to bring my focus back, focus on what we need to do, because if you don't have good GPA, it's difficult to find a job. It's difficult to even talk to the employers, right? And that's what we are there for, right? Sometimes, some people may just come back after doing a master's or a DPT, right? But if you are doing, or investing so much money, you may even have some experience over there. So GPA is important. All right. The next one is coursework is not easy, right? So you have to be dedicated. Like I just brushed upon that, right? So your professors are the best resources. They do understand the difference between what we study, or what where we are coming from. So a lot of it is the accent, right? And I think reach out to anyone who can help you, especially with books and with studies, right? They don't like plagiarism. That is, no cheating in any papers, any essays, something that, I'm not saying that we tend to do that or something. All we were like, okay, let's just, all of us can maybe think about it, but they know if you plagiarize, right? So I just wanted to put it over there, right? The difference in the English, well, that is something that we all are getting into. The accent, right? In the beginning, the accent is going to be the same. It's mainly the pronunciation, the jargon, and the written English. It is going to be different. You may feel that difference. Something that my professor actually said was, you have to start thinking in English. If you think in English, you will be able to speak in English, right? So we tend to think in our, our home mother language, right? So that happens. That's why the English can be a little bit different. Okay, but the professors are prepared for that. So as you get gradually into or stay in the US more and more, the English, we start acquiring that English or the American English. Okay, all right. So opting, you have to say yes for the OPT. OPT is optional practical training, right? So there's something called a CPT as well as OPT. OPT is after your internship there. CPT is something that you can even do before your internship. Okay, you can make the benefit or use the benefit of this. Experience is very important, right? It helps you find a job and even go into directly your work visa or whatever you're planning to do from there. Okay, extensive documentation. US, like I said in the beginning, US is based on that extensive documentation, right? So all the projects, whether it's patient cases, a thesis, it's very important. For them, everything is documented, and even online documentation, right? When I started working, I was only using online documentation. All right. On campus jobs, I think we just talked about it. Focus on your GPA more than on campus jobs. But if you get it, that will be, you will start earning that dollars, even if it's $10-15, that helps. Okay, extracurricular activities, you can, a lot of schools have a lot of extracurricular activities, even just sports. So spend that time there. Festivals, seasons, so those are certain extracurricular activities that you will experience. All right, so that was our studying part. The other aspect of being in the US is working, which is something that we are looking forward to, right? And why? One is the money, one is the experience, very importantly, right? And just to experience that culture, right? So working as the PT, the prerequisite is NPTE exam, National Physical Therapy exam. The requirement, that is the requirement. Each one of us will go through that, right? Each one of us have to study for that. So it's a pretty intense exam, right? Again, OPT, finding a job in another state. I did that. Once I completed my studies in MGH, all my friends went to New York because there were no prerequisites like general credits or anything like that. I got married. I moved to Seattle. And that was my choice. I feel now that I could have opted for the optional practical training, right? You get that experience, and even easier for the H-1B employers. So every state has their prerequisites to practice in the state. I got my Washington state license, which is still active after almost a year of the whole process. Now the process have been changed like I said, every few 6 months they change the process. So make sure you go through their website, and talk to them, call them. Questions, just call them. Okay, working as a PT, most importantly, the work culture, right? They are pretty straightforward. You have to work full-time, 8 to 5. They are mostly objective over subjective. Everything is documented. And because you're on H-1B, right, you are under more scrutiny. I can say that. But you have to be at certain hours when you're on H-1B or the work visa, 40 hours at least, right? Okay, work settings, various different settings there. Outpatient, inpatient, skilled nursing, home health. You have the choice, but you may not be able to get what you want in the beginning. The reason is H-1B employers. Okay, so you have to maybe find someone who can sponsor your visa. Okay, that's where it starts. So work visa and the green card. Work visa, which is basically H-1B, is 3 years plus 3 years. So you have to renew after the 3 years, and then that's totally 6 years. So you're good for 6 years actually. And in that process, start applying for the green card. But I don't want to get into the green card process, but basically green card takes forever to come. I would say most importantly, at least spend those 6 years experiencing that work culture there, right? And the working environment. And I can surely vouch for that. I was there. I've done the visa. I've done a dependent visa. I've done a green card. So it's, everybody goes through that phase. So let it go with the flow and do make your correct decisions. Okay. I just want to, share where I worked in the US. I've been in the US for many years now. In the beginning, when I didn't have a job, right, I was actually volunteering in rehab hospitals. It actually helped me get my first job, even if I was a volunteer. Somebody recommended me to, the employer, and this is where the communication skills come into picture, right? Or the networking. You network. After that, the first job I got was in a nursing home, and I was a lead PT there. After like few years, I actually was hired as a clinical director at an outpatient clinic. So I love the different. I wanted to try different settings, and that's what I tried this here. Is I also worked just before I came here, which was just 10 months back, right? I worked in a nursing home and an inpatient rehabilitation for geriatric population, right? So those working environments, you learn so much, you connect with so many patients, and there are really good cases. I mean, you may feel that the documentation is difficult. I won't say difficult, but a lot extensive. So you have to focus on that documentation. But a lot of it is learning at your working place, and that's what I think I loved about working over there. Lastly, this is my picture of my orientation day. That's at MGH Institute, right? I would like to say to each and everyone who is looking to go to US or any other country for further studies is learn and grow, right? As a physical therapist, promote your profession, be proud of that, right? I am proud to be a PT, and you keep growing, even if you are graduated, the continuing education is important, and meeting other people, learning from somebody else is very important, right? So be open about it. Learn and grow as a person. You may even find new sides of yourself, new hobbies, and new side of yourself, right? In US, being independent, being alone over there by yourself, right? Not alone, but by yourself. And as a human being, right, we work with all our patients very wholeheartedly. We strive for their best care, and this is where we have to grow. You have a global knowledge, and then I or even, I think Abinas, she also was working over in US, right? So we bring that what we learned over there, we can come back and bring that our brain, our skills here, whatever we learned over there, right? So explore the independence, but don't forget your roots, right? This is where you come from India, so make sure don't forget your roots. That's what I think, that keeps you going. I can say that keeps you going, right? Coming back to India always feels good. Explore the culture, but make sure you keep your identity. Don't lose yourself. I may be talking a little bit more philosophical, but these are some things that I learned, I grow, and I will keep, being proud of, being here in India, back again. Don't compare. Every culture is unique, right? So we don't want to point fingers at Americans or Britishers or Chinese. So that's where don't compare. Be yourself, right? And lastly, contribute to where you are, right? Patient awareness, share your knowledge if you have more, right? So those are some things in the community. And lastly, most importantly, above everything, just be a damn good physiotherapist, right? So I think, thank you for giving me this opportunity. I'm very happy to share this. And that's all from me, actually, Munira.
Yes. Thank you so much, ma'am. It was really great to hear from you. Thank you for helping us and making us aware about the why, how, and what of like studying and working in the US, and also for sharing your own experience and expertise. There have been like many points that you have mentioned which we usually miss out on. So I'm sure it's going to help most of us here and make our paths to the US, or for that matter, any other country, easier. So thank you so much.
Thank you. I'm very glad to do this, and I'm glad that it is helpful, right? So that's what we want.
Yes. Okay. So we'll now move on to a question answer session, which will be headed over by a panelist, Dr. Avinas. So handing over to you, ma'am.
Yes, very well presented session, Shweta. That was really
Thank
good.
you. Thank you.
Yes, you brought the whole experience. You brought the whole journey in such a beautiful words and in those
Mhm.
explanations. Well done, well
Thank you.
done. I know it is. It's a very different aspect of our life when we go and work there. And although I think our when I was listening to your talk, the starting, I think I did not go there to study. So I
Okay.
think the beginning of our journey may be a little different, but ended up as
Right.
if you go to work, then everybody is alike.
Yes.
Either you're an international student or from anywhere you've done your PT, you've got to sit for the license exam. Even the PTs there
Yes. Yes.
itself, right? So that's, I think, something that makes us even with everyone who across the board, whoever is working.
Yes.
I
That's
think
correct.
that's really good. I just wanted to, just curious, what was the hardest part of you working as a PT or outside of your country? What was that?
So the hardest part of working outside of, like right after internship, I actually went there. Maybe close to maybe 6 months I worked in Mumbai. But the hardest part of working over there is the communication. A lot of my patients, they actually even just speaking fast. I think I think I'm one of those who can just talk constantly. The patients there want patience. You should be grounded. It's almost like you think and talk. Don't keep talking. And I learned that was a hard way, right? I almost had to take some English lessons, even after TOEFL. I had to take some English, just American English.
Right,
And
right.
for my patient, I actually learned Spanish. So it's almost like you have to do the best for the patient, right? So that's what communication was one of the hardest. Gradually, it gets better. But
Yes, yes, yes. Gradually, it does get better. Yes,
yes.
that is, I think, and the people there are very warm and
Yes.
very accepting. I mean, there are here and there are always
Mhm.
some issues, but I think overall the culture there is, if you work hard,
Yes.
there's no way that you can, I mean, you
Correct.
will go up higher as you. So it's all about working hard. It's all about being honest,
Mhm.
um,
Very true.
being true to what and they are so open. If you tell them that no, I don't know,
Yes.
there's no judgment. I mean, they'll be more than willing to help you with the process. You'd be surprised. So when I went there, in fact, I went right after I finished my internship, and about 6 months, very similar, I worked.
Okay.
It was again, in my hometown, and then in that 6 months, I got married, and then I went.
Okay.
So it was like in that year, all those changes happened,
Mhm.
and so I think the so I started volunteering right as soon as I went there. I started volunteering in an outpatient.
Okay.
So what you just said, that voluntary work, I think, is a very big part of your
Of US.
of getting in, and that person actually made me so comfortable with the whole process of even to an international student.
Right.
I went the route of doing my credits. So
Okay.
so I did all my credits, and I have licenses of 5 states.
Oh wow.
So but then again, obviously, it was all about getting those credits in.
Yes.
So I think so, but I think those voluntary work is so important.
Mhm.
And I think down into your talk, what you said was the documentation. You bet on that. Oh
Yes.
my God, it was like, that was a very good point. And you know what? Not even just in the US. Um, going out of the country is one thing, but documentation here, when we are treating our patients, I think as an Indian therapist, we are not used to doing that as
Right.
much.
Mhm.
Uh, but I think that is so important. You learn the importance when you do it there, and then when you see that it, what's the difference. You don't realize it when you're not just doing it, and then it's fine.
Yes.
But then it's so good. So I think just whoever is listening or whoever will be listening to our conversations, as a PT, I think the documentation of whatever you do makes a huge difference. And now and then you'll realize that you either you save yourself or you get yourself to be a better clinician, because when you write it, like you said, you get better, right? So things. So I think that's just that is
Yes.
something that I really loved in your
Thank
talk,
you.
that the voluntary work and the documentation part was very good. Yes, yes.
Yes, thank you.
Right.
I wanted to add about that documentation just a little tiny bit. Why the documentation is so important? Because in US, everything is insurance based.
Yeah.
In my being a clinical director, I used to get Indian parents who are visiting, and we used to even charge them what $60 for a session. That is a lot. So even in cash, they will pay that. Everything is insurance based, and the insurance is actually paying you right directly. So that's one of the reasons you want to prove in your documentation why you want to do this, right? So I think volunteering helps you be in the same flow of PTs, and that's why I did that as well, right? To keep my knowledge aware, and that helped a lot, as well as documentation. So it's mainly
Right.
insurance based, and that's why we do so much documentation.
Right, right, and I think even in India now, I think it's good. It's just good to have documented. And what I think another point that you mentioned, that being more objective, is,
Yes.
I mean, it's all about testing there.
Yes.
You just cannot send somebody home without a valid test that the person is independent, or whatever your goal was to get them home or
Correct.
whatever. So I think that that is an important thing. That's
Yep.
a documentation part. Yeah.
Correct. Yes, that's correct. I
There was
think yeah, we have a question, Abhinas, I think.
Yeah.
When is can I say it or
Yes. Yes. Go
Uh,
ahead.
yes, ma'am, you
okay?
can go ahead. Yeah.
Okay. When is the ideal time or year to start applying to US? Well, right after internship, you can do that if you have decided. So think about those phases. If you've already decided that you have to go outside, out of the country, start right away, even before, in the process of internship. Um, and it's something that I can say, and of course, Abhinas can add more, is working in India. So you will come to know, like maybe even work for a year or two, you will feel the difference in working here and in US. So that's always good to do that. So there's no ideal time is when you decide, I can say that.
Right.
Best universities according to you for masters. Well, um, if, so I can say that masters now is actually not offered by universities. You may know maybe more than me. I have researched a little tiny bit. MGH, my school doesn't have any more masters. So you may have to just go directly for Doctor of Physical Therapy. And that's where all, basically APTA, American PT Association, they want all the therapists, even coming from outside, to be licensed as doctorate. Not They're two different things. Doctor of Physical Therapy. Okay, so there are really good universities. Of course, MGH is one of them. It's affiliated to Harvard, so I can for sure vouch for that. Pittsburgh, University of Pittsburgh, University of Loma Linda. I think these were like the five. You have to choose around 5 to 6 universities that you can apply. And some of my friends, some of my seniors, juniors, they also went for different kinds of masters, like masters of rehabilitation, exercise science. Even if you are a master's with exercise science, you are going to still be able to work as a PT. Okay, so there are different options for PTs, and that's where I think I didn't talk about that. Is the future for PT in US is you can actually go in different directions and even get your certification there. So many things that you can do, but you have to give exams for everything. So that's what I can say.
Yeah.
Yeah. Do you want to add anything, Abhinas?
No, I think that's it. I think that's what the different routes to go, but it's ultimately you've got to sit for your license exam, your boards. A master's is a good a way to do it. One of my other friends, she did her master's here. She's going for her PhD there. So there are different ways. You could wait a little bit. Maybe you can gather some financial support by then, so you can do various things. So there's not really an ideal, not in a specific ideal time. University wise, I agree. You've got to choose your 4 or 5 options. But again, and I think initially when you were talking in the talk, maybe being closer to family helps, if that's an option at all.
Totally.
That is something one of my colleagues who was talking about. A brother is in Texas, so she got into, Texas University. So I think that things like that, whatever is convenient. But I think it's the first. What I would go back to Shweta's first slide is deciding that you need to go. Decision is the important part, and then you research, making your mind, focusing and making your mind is the thing. Once you get there, then you will fall in, deciding the country where you want to go. US is an expensive country. US is a unless you start really earning in those dollars, it is very draining money wise. It is a very draining, that way. So you choose your destination is important. Then I think, then you work on the institution. Then again, like I'm sure all the institutions who offer masters or any other, higher education, they have their own deadlines, your summers, your fall, and, whatever. So that's, I think, depending on the university, or, you can kind of do that. Also depends, do you really, I love Seattle. That's I told my husband before we head back, I need to go to Seattle once. So prior to coming, the last 2 years, I think we went. Anyways, but I love New York.
Yeah.
It is like my life. So the last 5 years we were there and I loved it. It was a best part. So I think deciding then, something about this place, but I think the decision of going where is an important part.
Absolutely. I think when you said about the family members close to you, for me, my brother was a pillar, right? He was like the everything, like support system, because I was alone. I didn't actually like the first few days in US. So if you have someone who you can trust, like I said, my brother did pretty much everything for me. I made him do, I should say. So even just buying a mattress, he put it on his card and then got it, right? So little things like that. But you will appreciate the value of being with the family only after you live in US or any other country. Okay.
And I think I'll add to it. And you will appreciate doing everything on your own.
Yes.
You will shop, you will cook, you will clean. That's like clean everything,
Yeah.
So that's, I think, the best part. It makes you so when we came back, I used to hate somebody opening doors for us. Like, no, you don't open doors, you leave the door open. And there are some etiquettes that we learn as we get in the culture. Learning a culture is very important. They teach you to be humble. Even a teacher would hold you, and if even if a dean is walking in front of you, he will make sure that he keeps the door open for you, whoever is coming behind, right? So it's not that who you are, it's what you are. You respect the other person. It's just a beautiful thing. I really realize that how humane you can be. It's just beautiful.
That's true.
Yeah.
I just want to maybe ask Abhinas, what made you decide to come back? And I can always share that as well. That's biggest decision I think of my life, I can say, is moving back to India.
Yes.
So, and I think maybe a lot of students may think about it, like, you're like, I don't want to stay there, I want to come back. And we can just share that little thing.
Yeah, coming back. So see, while we were there, I had my kids there, so that was that. And then I think to maybe working so many years, me and my husband, we decided that just for a few years we'll go back,
Yeah.
until the kids grow up a little, and then we come back. Then we can decide. But the coming back, I think the part was that I don't know. I think initially, or the basic of what it was, I just wanted to give it back to my community. I think I just wanted to be with my people at the end. I used to tell myself that, oh my God, at some times, oh, I wish I could just, do it over there. I just, because there was so much that, you learned and so much was different. And then I think that was the part that I just wanted to give it back,
Yeah.
and then I think that was it.
Totally. That's true.
What about you?
So giving back is, of course, one of them. Being close to parents is secondly, of course, with the pandemic.
Family was definitely.
Yeah. And, we always think that the lifestyle in the US is addictive. I have written this in my blog. It is addictive. You will not want to leave the country. Okay. And even just the space, you don't want people around you after, like a private space. You become a private person after a while. So coming back to India was, of course, giving ourselves a chance to explore India. I can say that. My husband has a startup here, and I'm also starting fresh. But I think this is going to be, it's also good for my daughter to explore the other side of, the whole world. So coming back to home feels warm, and I'm very happy to be here. It is the work culture is very different in India, but as compared to US, but I would say it's warmer. People are still they accept you. So they have their own shell in India, I'm saying, and that's which is good. You can always expand. You can always meet individually people. US is all about visas and all about talking to the employers. So you have to go through that route of visa. We were actually tired of being in the visa. We were done with the green cards.
Yeah. I mean, yes, the documentation and the whole work, that is a bit tiring.
Yes.
By grace of God, I never had to deal with it too much, because my husband and his company used to deal with that eventually, so that was the lucky part of that. But yes, there's so much effort that goes into that paperwork that sometimes is draining. You're like, what, just leave everything and let's just go back. I know. But then I think the addictive point, that is very true. That is a very true thing. The life there is so defined, so and I mean, it is a land of possibilities. They say that it's a land of possibilities. I mean, you can do anything you want. If you would want, you can go back to med school and study more. I mean, that's how exciting that land is.
Right.
So, but I think at the end of it, what your priorities are, and then you just go along. Yep.
Yeah, that's true. So I think from my side, that is pretty much it. You can reach out to me, I think, on the website or on my message, on my phone number. If you want, I can always share it. So no, not everything is going to go. So
yes. Right. Great.
Thank you.
Thank you.
Thank you so much. Yeah, that's all.
Thank you.
Thank you so much. It was great to hear from, you both talk about so many important things that we need to consider before going to US. You both have indeed put best of your efforts and knowledge, and we are highly obliged for it. I deem it a great honor on behalf of the organizing team to propose a vote of thanks. I express my gratitude and respect for our distinguished panelist and guest speaker, Dr. Abhinas and Dr. Shweta, for not only sparing their valuable time, but also for enlightening us with their commendable talk and discussion on this subject today. I would like to thank our founder and president, Dr. K.H. Sancheti, Chairman, Sancheti Institute of Orthopaedics and Research, Dr. Parag Sancheti, Executive Director, Sancheti Healthcare Academy, Mrs. Manisha Sangvi. I would also like to thank PhysioTV for hosting this session, and Sancheti Institute College of Physiotherapy for giving us this platform today. Thanking our technical team as well. And before signing off, I would like to thank our viewers. I hope you all keep connecting with us on this platform for the coming sessions and events as well. Stay safe and take care. Thank you.
Thank you.
Thank you.